Happens to your body when you get COVID-19?
Experience. From the first thing I've seen as a physician is fear. I see fear in the eyes of patients. Fear is a very unpleasant emotion that no one wants to experience, especially if there is a possibility of death. I see a lot of fear. One thing every physician and healthcare worker that has taken care of COVID patients know is that the coronavirus affects the patient from head to toe. With regards to the brain, the patients who have been infected with this coronavirus tend to get very confused. A lot of them get agitated. They start pulling out their IV lines. A lot of them start pulling out their oxygen tubings. The ones that have bigger masks, called the BiPAP mask, they start ripping off their mask. They get very confused. When they get back to their normal senses, they apologize because, as a matter of fact, most of them don't realize that they're doing that. Then you get down to the lungs. One of the most common organs that this coronavirus affects is the lungs. Most patients will have what we call pneumonia or infection of the lungs. When part of your lungs are infected, you find it more difficult to exchange air and gases. People start gasping for air. People want more oxygenation. That's when the supplemental oxygen comes in. That's when you see patients who have small tubings into their nostrils that supply them oxygen. The more infected the lungs are, the more their oxygen requirement. We see other patients that have tubings that supply them with more forceful oxygen through a machine called the vapotherm. We also see other patients that unfortunately the disease has gone through all their lung lobes, the entire lungs become infected. They go into what we call ARDS, or acute respiratory distress syndrome. For some of these patients, we actually have to put them on a ventilator machine, or the machine we'll call the life support machine, to help them breathe. The next organ that this virus infects is the heart. Most of these patients go into what we'll call AFib. Some of them go into irregular, very fast heartbeats, where the coordination of the heartbeat is not there anymore. Some of them actually have what we'll call bradycardia, where the heartbeat is so slow that the heart is not pumping as it ought to. With regards to the heart being the powerhouse of the whole body, some patients go into shock where they are not able to sustain a good blood pressure. So they are not able to properly pump blood to be able to give blood to all the vital organs like the brain, the kidney, the liver, and all other organs. With such severe patients, the doctors have to put them on a blood pressure drip. These medicines that we put them on will help to keep their blood pressures up in order to perfuse these essential organs. We get down to the kidneys. This virus infects the kidneys and shut the kidneys down in very severe cases, making these patients to require hemodialysis, where they have to have a machine pretty much clean out the toxins from their blood and give that blood back to them. In some other patients, it infects their liver and shuts down the liver. These patients are not able to excrete toxins or break down toxins. So these patients tend to keep these toxins in their bodies because their liver is no longer functioning like it ought to. When these patients get to a certain degree of liver failure, they are not able to produce clotting factors that will help you clot blood when you bleed. These patients, it's easy for them to bleed out. This virus causes a very severe inflammatory reaction to your entire body. This inflammation can cause production of blood clots. If these blood clots go to your lungs, you have what the doctors call pulmonary embolism, or blood clots to the lungs. And of course, it makes the breathing even more difficult. If the blood clots go to your brain, it can cause a stroke. If the blood clots block the blood vessels of the heart, it can cause a heart attack, or if it causes a big blood clot inside one of the heart chambers, that can spread to your brain and cause a stroke, or again cause a heart attack. COVID-19 can infect your entire body system. For patients that survive this, we have them having lingering symptoms, and these patients will call them the long haulers. Most of these patients will tell you that when they take a little walk, when they exert themselves, they feel short of breath. Some of these patients will tell you that they cannot sleep at night. They have insomnia. Some of these patients will tell you that they have tingling of their feet, tingling of their fingers. Some of these patients will tell you that these symptoms persist, or that these symptoms go and come. You have to understand that, like most viruses before the coronavirus, this is an emerging infectious disease. Scientists and physicians are doing all they can. And finally, we have a vaccine that is able to help combat this virus. The people that have gotten vaccinated and yet have become infected with the coronavirus have milder symptoms than people who have not become vaccinated. In the hospitals currently all over the world, and especially in the US, unfortunately, most of these people are young people. People in their 20s, 30s, 40s, and 50s who did not get the vaccine. I encourage you, if you're at least 12 years or older, please get vaccinated. This is a public health issue. This is what we call a pandemic. The only way we can keep this virus, like most other viruses before it, under control is by doing our parts as citizens of this world, by getting vaccinated.